Equality and diversity. Introduction. Equality means ensuring that everyone has an equal chance and that they are not discriminated against because of their differences. Diversity is defined as the consideration of differences between individuals and groups of people, as well as the positive value placed on those differences. Every worker should have an equal opportunity to upskill or learn something new at work, regardless of their age, race, gender, class, sexual orientation, religion or belief, disability, or passport. The same rules apply in all aspects of life. Still, they are particularly important in health and social care, where people with special needs, disabilities, or the elderly may find it difficult to care for themselves. According to Age UK, the number of older people is growing, posing unique challenges. With over 12 million people over the age of 65 and an increasing number of people living into their 90s, 500,000. Policy statement. Patients. Patients and their families have the right to be treated fairly and to be regularly involved in treatment and care decisions. They can expect to be treated with dignity and respect, regardless of their age, disability, gender reassignment, marriage and civil partnership, pregnancy and maternity, race, religion or belief, sex or sexual orientation. Patients owe it to other patients and our staff to treat them with dignity and respect. Staff. Employees have the right to be treated fairly in terms of recruitment and advancement. Employees can expect to work in an environment that values diversity and promotes equality of opportunity. Age, disability, gender reassignment, marriage and civil partnership, pregnancy and maternity, race, religion or belief, sex or sexual orientation will not be grounds for discrimination. It is the responsibility of the staff to ensure that our patients and their co-workers are treated with dignity and respect. Diversity in social, cultural, and economic terms, for example faith, gender, sexuality, age, family structure, social class, language, dress, food, music, the arts, education, employment, expertise. Rights and equality, for example right to be respected, treated with equality, and fairly, respected as an individual and not discriminated against, privacy, dignity, protection from danger and harm, right to access information relevant to themselves, right to communicate using their preferred methods of communication and language, right to be cared for in a manner that takes account of their needs, choices, preferences. Promoting equality and diversity of people who use services, promoting individual rights and beliefs, maintaining confidentiality are among the values of care, health, and social care settings. Early childhood values, for example, putting the child's welfare first, keeping children safe and maintaining a healthy environment, collaborating with parents or families, supporting children's learning and development, valuing diversity, equality of opportunity and anti-discriminatory practice, maintaining confidentiality, working with others, reflective practitioners. Understanding diversity has the following advantages, for example empowerment, independence, inclusion, equality, respect, dignity, opportunity, access, participation, anti-discriminatory practice. Equality, diversity, rights, opportunity, difference, discrimination, stereotyping, labeling, prejudice, disadvantage, culture, beliefs, values, expectations, empowerment, independence, vulnerability, abuse, interdependence, racism, sexism, ageism, and homophobia, to name a few. Residential care, daycare, nursing care, domiciliary care, and early childhood care are examples of health and social care settings. Importance of equality and diversity. If you work in health and social care, it's critical that you consider equality and diversity in everything you do. At some point in their lives, everyone will require assistance from these services, and people of all backgrounds should have equal access to care and be treated with respect. The elderly, special needs patients and people from all walks of life and backgrounds will all require assistance at some point in their lives, and it is critical that everyone's rights are safeguarded and protected by law. Without legislation to ensure equality and diversity, the health and social care system could devolve into a two-tiered system where only those who look and act like the people treating them are listened to and treated properly. For the elderly, those with special needs, and people of color, this is bad news. Inequalities in healthcare. Recent and current health policy includes efforts to reduce health inequalities. These are primarily aimed at reducing geographical inequalities, differences in health outcomes and services, as well as inequalities among different social groups. According to the inverse care law, the availability of good medical care varies inversely with the population served need for it. Inequalities in health are pervasive in today's society. The place where a person is born has an impact on how long they live. The government established a national target aimed at reducing health inequalities by closing the gap in life expectancy and infant mortality. For the first time, healthcare imposed legal obligations on clinical commissioning groups, CCGs, to reduce health inequalities. These organizations must take into account the need to reduce inequalities between patients in terms of access to and outcomes from healthcare services, as well as ensuring that services are delivered in a way that reduces health inequalities. Individual practitioners, healthcare organizations, and countries all have different approaches to healthcare. Some approaches to healthcare are acceptable due to patient preference or underlying medical conditions, while others are not. These are divided into 3 categories. Effective care, clinical evidence supports different treatments. Preference-sensitive care, where alternative valid treatment options are available, and variations are caused by patients exercising choice. Supply-sensitive care, variations reflect the different availability of alternative treatment approaches. Measuring health inequalities can be achieved by measuring health needs, measuring demand through health needs assessment, measuring access to health care, measuring supply, C-section measures of supply and demand, healthcare use, for example avoidable admissions, barriers to admission, for example waiting lists, patients' perceptions of healthcare provision. Measuring quality of healthcare. Equity in healthcare. Health is influenced by various factors, including genetic factors, so complete health equality will never be achieved. Equalizing health can be seen as paternalistic because it ignores personal preferences such as the decision to smoke. Vertical and horizontal equity is defined in Aristotle's formal theory of distributive justice. Horizontal equity refers to equity between people with the same healthcare needs, whereas vertical equity refers to those with unequal needs which should receive different or unequal health care. 1. Vertical equity is the unequal treatment of unequal and can be justified based on morally relevant factors. However, morally irrelevant factors should not be the basis for employing vertical equity. 2. Horizontal equity, equal treatment of equals. That is to say, vertical equity in healthcare can be justified if morally relevant factors are present. Morally irrelevant factors, on the other hand, do not justify vertical equity. Commissioners of healthcare are constantly faced with equity decisions, owing to the need to prioritize and eventually ration healthcare to meet budgetary constraints. Commissioners are increasingly implementing priority-setting policies for the equitable distribution of healthcare resources, largely based on the distinction between morally relevant and irrelevant factors. However, not all moral decisions will satisfy everyone, so any priority-setting decision-making process should focus on achieving consensus and consistency rather than achieving the correct answer. When demand is high, our staff has noticed that services may not be able to prioritize developing new ways to address access barriers. However, GP and hospital services are working to improve access for the various communities they serve in a variety of ways. Good leadership and culture, as well as reaching out to local communities, are important factors in achieving success. Specialized health and social care pathways to support certain groups of people are not working well across England. As a result, some equality groups are unable to obtain high-quality services that meet their needs. The current system of care for people with a learning disability and/or autism, which includes national bodies, providers, and commissioners, has failed people whose care pathway ended with them being segregated in a hospital. As we stated in our interim report on restraint, segregation, and seclusion, the system is unfit for purpose. Inclusion. Inclusion is critical for ensuring that each individual has a meaningful role in the group, community, or society in which they live. Consider how you'd feel if you had no control over your life or your care and support. Inclusion entails more than just getting involved. Inclusion means respecting everyone's right to reach their full potential by allowing them to work toward their personal goals and receive the help they need. Valuing each person's right to a meaningful role by determining what role they want and assisting them in achieving it, such as a parent, partner, employee, or group member. developing a person's confidence, self-esteem, and respect by enabling them to recognize their own abilities and developing their confidence, self-esteem, and respect. Supporting each individual's active participation by allowing them to take part in new and different activities. This includes opportunities to socialize and form bonds with other people. When assisting individuals in developing a positive sense of well-being, it is critical to understand what inclusion entails. Understanding and supporting inclusion entail assisting individuals in taking charge of their own health and well-being. This will allow them to meet their individual needs and live happy lives. Value diversity. Working inclusively is aided by valuing diversity. By doing so, the health and social care practitioner acknowledges that each person with whom they work is a unique individual. Respecting individual differences, as well as valuing diversity, contributes to inclusive practice, for example by supporting an individual to practice their faith or to eat a vegan diet. Ensuring individuals remain at the center of their own care and support, for example by encouraging an individual to focus on their abilities, or empowering an individual to express what they want when recovering at home from a fall. Understanding individuals' differences, for example by finding out how an individual would like to be moved from one position to another, or what services an individual would like to access when recovering at home from a fall. Access to services. When people plan their care and support, health and social care professionals can contribute to inclusive practice by sharing their knowledge of available services. For example, the health and social care provider may have prior experience assisting others in obtaining various leisure services in the community. They may have gathered useful information about the services each one offers, how much they cost, and their advantages and disadvantages. This information could then be given to the person, who would then be able to make an informed decision. Furthermore, when providing individuals with the care and support they require to meet their unique needs, views, and preferences, the health and social care practitioner can demonstrate inclusive ways of working. Information and suggestions in health and social care. Information and advice are required for a variety of reasons. Getting to know people, collaborating with others, planning people's care, and providing consistent care and support are just a few examples. Practitioners in health and social care can also help to promote inclusive practice by ensuring that the information and advice they provide to individuals and others are accessible, provided in a format that the individual and others can understand. For example, this could entail using clear, non-jargony verbal and/or written language. Suitable, provided in a manner that meets the individual's and others' needs. For example, when advising a deaf person, you might use sign language, or when emailing a relative about an aspect of their care, you might use a formal writing style. Impartial, provided in such a way as to have no bearing on the individual. This could include explaining the benefits and drawbacks of a variety of activities that are available to individuals. This will enable them to make their own informed decisions about which activity they want to engage in. Up to date, provided in a timely and current manner. When an individual's physical needs change, for example, this must be documented clearly and promptly. This is so that the individual's care and support can adapt to their changing needs. Thank you. See you in the next lesson.